First, there was DMS, a group of doctors set up to provide out-of-hours cover. A few years later came DHC, providing unscheduled clinical care in the same area. 5 years ago, they merged to become DHU, Derbyshire Health United. It's a not-for-profit social enterprise with a commitment to people in its area to do the right thing in the right way, at the right time, in the right place. Jackie Cabler has been to see how they do it.
Derbyshire Health United was formed in 2004 when services in the north and south of the county joined forces. It now provides a unique, fully integrated out-of-hours and 111 service for Derbyshire and 111 services for Northamptonshire, Nottinghamshire and Nottingham City, plus healthcare for local prisons, forensic medical examiners for the police and Right Care, a specialised patient care plan.
Have you got any pain in your abdomen as well as your back? You've got a little bit of stomach pain.
The gold standard out-of-hours and 111 service means if patients don't need emergency 999 care, they can speak to advisors here and book home visits or appointments. DHU is a not-for-profit social enterprise, born of the need for out-of-hours care after the introduction of the new GP contract. From the start, its high standards of care and efficient use of resources have achieved government targets, with a highly ethical approach.
Being a social enterprise, not-for-profit, limited by guarantee, is very important to the transformation agenda. DHU is able to commit all of its time and all of its energies and all of the commissioning money to transforming the urgent care pathway. Also, as an employer, we're very attractive to people who share our ethos. Many of our staff support charities of their own choice in their own time.
DHU puts any profit into new equipment, staff training and improving services for the community it works in.
There's a great deal of talk in the media about privatising the NHS and a lot of anxiety about money being diverted away from patient care. But companies like DHU and social enterprises exist purely to serve patients. All of the money the NHS pays us is reinvested again back into patient care to deliver a safe and effective service.
Right Care is a scheme designed by DHU to ensure seamless patient care out of hours, ideal for end-of-life care and patients with long-term or complex conditions. A Right Care treatment plan is devised with patients by their own healthcare professionals and then shared securely with DHU, where it's available to all relevant parties. Dialling the Right Care number means patients can usually speak within 60 seconds to someone who can access their details and help them.
If a patient is in a period of crisis or distress, they may well feel very anxious and be prone to ringing 999. That will of course possibly lead to unnecessary admissions. Well, with Right Care they get appropriate advice straight away, and that will allay their anxieties, and then they will hopefully avoid an admission.
Adam Reynolds has personal experience of the benefits of Right Care, which helped his grandmother in the last days of her life.
You hear all sorts of horror stories that people are left on hospital beds to die, or they're dying in the ambulance or what have you. This just avoids all of that. Make sure you get the right clinician out to your home or to their home to ensure that they get the best care. And in my grandmother's case, make sure that she could die peacefully in her own home.
Good morning, NHS 111 service. My name's Abby. I'm a call handler. To the telephone number you're calling from.
As a not-for-profit social enterprise, DHU is an industry leader in best practice that offers real value for money for the taxpayer and the highest standards of care for the counties and communities it serves. A true example of how the private sector can work hand in hand with the NHS for the good of all.